Welcome to the Globetrottin ADs. This podcast is for you, athletic directors, activity coordinators, coaches, and program associates based in international schools around the world. The Globetrottin ADs is proudly hosted by Nick DeForest from the American International School Vienna and Matt Fleming from the American International School of Budapest. Here they are now, Nick and Matt and the Globetrottin ADs.
Hello, everybody. Welcome to this week's episode of the Globetrottin ADs. Today, we're going to continue our series of topic of responding to abuse in sports. The episode we're going to talk about today, the topic concerns all forms of abuse that can occur in families or sports programs, and how coaches are often first responders to abuse, as they often notice signs of abuse or are told about it from their athletes. A primary focus of our series on this topic is to bring further awareness and links to assist school-based professionals. So today we are honored to have our special guest, Dr. Jgreenbaum. Dr. Greenbaum is a physician from the U.S. who works with children who have experienced physical or sexual abuse, neglect, sexual exploitation, or sex trafficking. Her home base is the Children's Hospital in Atlanta, but she also works for the International Center for Missing and Exploited Children, providing training and education regarding child maltreatment to professionals globally, and developing programs to increase awareness of child sexual violence and exploitation. We just want to give a reminder to folks also, a safe space reminder, that we are talking about very sensitive topics concerning abuse, and the conversation may be explicit. There are likely to be listeners who are survivors of childhood abuse or supporters of survivors. It's okay to feel strong emotions. Please take care of yourself. Listeners can learn more about childhood abuse signs and indicators at how to respond when you suspect abuse at the ICMEC website. That's edportal.ecmec.org. So now I'll turn it over to Nick.
Yeah, thanks, Matt, and welcome, Jordan. It's really great to have you here.
Thank you.
Just to get us started, I know Matt just gave a great introduction there, but maybe you could just briefly talk about ICMEC and what you do with them, and a bit more about your role.
Sure. Thank you. Yes, most of my role with ICMEC, or the International Center, is to provide training to healthcare professionals, educators, and others who work with children about child sexual abuse and exploitation, as well as other types of abuse. Physical abuse and neglect are big. And then I work to try to develop programs in different countries to help increase awareness and improve response to child maltreatment.
Okay, wow. And do you travel around the world with them, or are you just really stay in Atlanta and work remotely?
Fortunately, I do a lot of traveling, although that has all come to a grinding halt with COVID.
Sure.
I used to do a lot of traveling and hope to do so again in the future.
Okay, great. Well, as we did at the last episode with Lori, we're going to kind of highlight a case. And the case today is St. Mike's College in Toronto. We're just going to play kind of a short introduction from ESPN Hidden Horrors, and we'll put the link in the bio, but just about a 30-second introduction that'll kind of kick us off.
Don't move, just stand right there. You got
In my time, hazing was the wedgie pull.
I don't understand how it goes from hazing to full-blown sodomy.
They're using their fingers, they're using broomsticks, they're using pool cues.
These are kids, 15, 16-year-old young boys.
You're not supposed to forcibly do that to somebody.
This has ruined his life.
Yeah, St. Michael's College. It's a private Roman Catholic school in Toronto. There's about 1,000 students in middle and high school, and they just have a great reputation for academics, but also athletics. Being Canadian and living in that area myself, I know about their hockey team, as most people do. They have almost 100 people in the NHL, from hockey Hall of Famers, all of many ages, and it's really a long athletic tradition they have there. I've played against them in my time in high school. Been in that rink, played a few times with them. So when this story hit the media and the worldwide media, I definitely took notice because of the connection and their history. So just a bit about the case. We'll go through the timeline. It's I think we could talk hours about it, but it's It's a bit overwhelming, of course. It was November 12th, 2018, when their head of school received an anonymous video showing a middle school student surrounded by others in a locker room with his head being dunked into the water in a sink. And the students look like members of the basketball team. So that evening, he expelled 3 students that were identified. In a second video that he received, also anonymously. In the second video, the student was being sodomized with a broom handle, a very explicit video, and it was clear that there was multiple middle school football players in the video. So the next day, the head of school met the students and their parents that were involved in that second video, and at their request, he agrees to keep everything quiet. He's informed by another school, though, that the video is being shared. So now it's outside their walls, and the students committing the offense in the second video are expelled. He schedules an assembly to talk to the whole school about it, and he actually calls the police to ask them about that first video in the sink, just to see if it could be a crime as well. He doesn't talk about the second video, but the police they discover the second video on their own from the media. So it already hit the media. And then I guess it turns into a bit of a mess. To put it lightly, the press are at the school gates. The parents are demanding answers. Students are harassed to and from school. And he goes on national television, the head of school does. And basically he says that, he didn't report it because he was following the request of the parents. Obviously the head of school, the principal, then resigned. Boys were arrested and ultimately sentenced to probation and community service. The boys in question, because of their age, weren't ever identified. 2 were 16 years old and 1 was 15. So clearly many lessons to be learned from this case, but we're talking about it really because of the victim's behavior. So this school had victims of both physical and sexual abuse with many witnesses, but even after it was reported, parents asked the school not to report the case to the police. So Jordan, we want to know, is this often the case, that people do not want to have abuse reported? And if so, how can we know that it's happening if it's not being reported?
I think that it does happen fairly frequently, that people want to protect their children and protect the reputation of the school and sort of wish it would just go away. So they don't want to necessarily take the official steps and call the police. The problem, of course, is that there may be other victims who are being victimized or future victims. And if we don't do anything, then the other people may become endangered as well. And it sends a message to the victim that this doesn't matter, that we don't care, which is a very negative, powerful message we want to avoid. So there are a number of reasons that these incidents do need to be reported, but also common reasons why they aren't.
And this wasn't a standalone incident. It was bullying and hazing, right, in this athletic atmosphere.
Yes.
So is that more common to keep it quiet because of the, let's say, tradition of this hazing?
I think in some cases that does play a role. Certainly, I think it depends on the case, but certainly long traditions and sort of an accepted culture of violence and tolerance of that make it easier to look the other way.
Okay. In your experience of working with these victims, do you think there's a trend in the States, maybe perhaps that traditions such as this might be going down, or is this continuing on, or what's your take on the current status of these types of hazing incidents in the U.S. or in North America?
That's a great question. I don't have the answer to that. I think that a lot of it is not reported, and so it's hard to know what the true prevalence is and what the trends might be over time, because I think it is very much underreported.
And that's a lot of times because the victims are scared to come forward, or is it, what do you think is the reasons?
I think, again, it's multifactorial, but fear of the victim of reprisal if they come forward, shame, bullying. They're concerned about what's going to happen to them, to their family, what the future holds. They have no idea what the police would do, if anyone will listen. Distrust of authorities. All of these reasons may be playing into a child's decision not to come forward, and then the parents have their own concerns about the child and views of what they want as well.
Right. So in the St. Mike's case, the 3 boys, they were involved in that second video, the sodomizing of the other middle school student. But the first video that actually the head of school wanted to find out more about when he called the police, where the boys were being dunked in the sink, or the boy was being dunked. That's also considered abuse, I guess, a different
abuse or assault. Yes, I mean, they're intending to scare and potentially cause harm to the child. It's a very dangerous thing to do. So yes, I would consider that abuse or assault.
So it seemed like that was overlooked, obviously, when the second video and the more graphic incident appeared. But
looking through the lens of a coach, maybe, or a person in a school, because often coaches, of course, are trusted adults. And this is, I guess, we're trying to get towards indicators, and because coaches would likely be the ones who would see signs of abuse, perhaps, or teachers or folks in the school, other professionals, aides, other people working in the school. Could you kind of walk us through the signs and indicators of physical abuse, and what are some signs that folks might be looking for, or what could be some of the things that might see?
Yeah, absolutely. I think for physical abuse, injuries may be obvious, and the types of injuries that concern us are those that are in normally protected areas of the body. You could argue that any active child, especially a school-age child, can get bruised anywhere with play and especially sports and stuff. So they can get bruised anywhere. But no matter what the age is, you tend to bruise less frequently in certain areas of the body, like the neck, for example, or the chest and abdomen. They can be involved in accidental trauma, but much less likely than the bony prominences, such as the knees and the shins and the forearms. So when you see bruising on the torso, especially the chest, abdomen, buttocks, genitalia, the clusters of bruises on the upper arms that may indicate the child's been grabbed very hard, bruising on the front or back of the thighs or the inner thighs. These are all areas that are generally more protected. And so if a child does have bruises there, sometimes it's helpful just to say, hey, I notice you have a big bruise on your belly. What happened there or something? And just, see often if it's an accident, the child can say, oh, I was tackled by da-da-da-da. And they can just give you the history. So it's the location of the injury that's concerning in some cases. And also another type of injury that worries us and is a possible indicator of abuse are injuries that have a pattern to them. So if somebody is beaten with a belt, for example, they often will have long lines of parallel bruises, 2 parallel bruises running in a line, often on the back, buttocks, back of the thighs. Sometimes they have them on their arms because they try to shield themselves with their arms, and so the forearms or upper arms get bruised. If a child is struck with an electrical cord, for example, there may be very narrow parallel lines that loop over, so it looks like a loop mark on their back, and often these are crisscross because there are multiple blows. Burns that are inflicted are more likely to have a distinct pattern of the object used to burn somebody. So when you notice a pattern to an injury, that increases the concern about it. And then there are non-specific signs of physical abuse or sexual abuse, or really any kind of trauma. And those are much more subtle. A child can have changes in behavior, for example, become much more aggressive and start bullying others because perhaps they're beaten at home. They may become very socially withdrawn. Or they may start using drugs or alcohol, have differences in behaviors, start hanging out with different friends, for example. And these are all non-specific behaviors, but changes that may alert you to the fact that the child is experiencing a lot of stress, be that sexual abuse at home or school or physical abuse or something else going on in their lives.
Right. And I guess change behavior, also change of the clothes to try to cover it up, right? If you're playing outdoor sport and it's warm, and everyone usually wears small, short clothes, and there's someone with long sleeves, could be a sign.
Exactly. Or if they consistently miss Monday on school, or if they were beaten up the weekend and the injuries are healing, and then they come back and they've got long sleeves on. Those kinds of things are things to notice. in general, signs of stress and trauma can be very nonspecific. There's a lot of reasons for them, but other things to look for are, the child's not doing as well in school, for example, or not wanting to play in athletics, isolated from friends. Sometimes there are physical signs of stress. Children will complain of pain. I've got a headache, I've got a backache, I've got a stomach ache. And next week it's back to the headache. They're always at the nurse's office. That may be a sign of a lot of stress, and that's their way of dealing with it. Some kids will stop eating and lose a lot of weight. Others will increase their eating and gain weight. So there's just a lot, or they'll complain of sleep problems. These are all very nonspecific. They could be anything, but the change is what's important.
Well, because they're not so specific and could be so varied, if we see something, it's got to be important to how we approach a child about it, right? We don't want to scare them away or make it too easy for them to just brush it off. So, how should we best approach someone that we suspect could be a victim?
Well, let's take an example. Suppose you have, a 10-year-old a 10-year-old, say, girl, and she's got a cluster of bruises on her left upper arm. And you also notice in the past she's had a black eye that she sort of shrugged off and didn't say much about. So this is the second time you've noticed bruises on the child. And this really looks like a cluster of bruises, like someone grabbed her really hard. So maybe you notice that while she's out in the field playing, and you might want to just try to find a time to talk to her afterwards, so that, get some privacy, make the child feel safe. So you might say, well, let's go for a walk, or let's go sit over here, near the benches, so that other kids are not listening. And just say, I know she had some bruises on your arm. Do you remember how those happened? And she may say, oh, it was nothing. And then, I don't remember. And then you might say, well, I'm just concerned because it's kind of an unusual place. You don't remember what happened? No, I don't remember. And if you talk on, you might want to ask more open-ended questions. How are things at home? How are you doing? And sort of open the conversation that way. But you wouldn't want to push it. For example, you're not interrogating the child, but just sort of giving them the option, opening the door.
And then from that point, what would be a suggestion you would have for the next steps? Because there's, I know in our school we have certain protocols. If we suspect abuse, to take it forward to the administration, and they'll take it from here. Because every country, of course, internationally has different laws in regards to abuse. But in general, what would be your suggestion for next steps forward?
Well, let's go back to this case. So we've got a child with kind of suspicious-looking bruising. We don't know that it's inflicted at all. We don't know it's abuse. But she's sort of shut down on us, is avoiding the question. We're concerned there's a prior injury. I think that altogether, that raises my concern that there's possible abuse. I don't need to be certain that she's been abused. I just need to be concerned about a reasonable suspicion. So that would make my next step be to report to the child protection officer at your school, whoever that may be, so that you can tell them about your concerns and they can decide what next steps would be. They would probably want to talk to the child themselves. They may, depending on the laws in your country and what might happen, really will influence what happens next. But as your job, you'd want to take it to the next level. However, I would not do that without telling the child, because we want to be very transparent about it. So let's say she's shut down. I don't really want to talk about it. Is there anything else? I want to go. And then I would say something along the lines of, I'm concerned about those bruises. Sometimes when I see bruises like that, it's because somebody has tried to hurt a child. And so I'm worried about that. I'm not saying that's happened, but I'm worried about that. And because I'm concerned, I need to talk to, you want to say it's a specific person, I need to talk to Mr. Joseph so that he can help me to help you. The child may very well say, I don't want you to tell him. Forget it. No, don't tell him. And you would still have to tell. And you can be very calm and say, I understand you don't want me to tell him. Can you tell me why you don't want me to do this? Let's talk about that. So you're getting them to open up a little bit more. And then you can follow up by saying, I understand. I know this is really hard, but I am obligated by policy and also because I'm concerned about you that I need to notify Mr. Joseph. But I don't have to do this alone. Let's you and me decide how we're going to do this. This way you're giving control back to the child. You say, how do you want to do it? Would you like me to go tell Mr. Joseph? would you like to tell Mr. Joseph, or would you like us both to go tell Mr. Joseph? That way you're saying to the child, here, we're going to work together. I'm not going to tell you what I'm going to do. We're going to work together. And that gives the child some semblance of control. I think that's really important. It also shows the child a lot of respect on your part, because respect and this sense of empowerment for a child is really critical. So that would be how I would handle that.
That's great. That's great advice, because I think that is often the case where a student doesn't want to say anything, right? But what if we get to get a student or someone we know that does tell us, they do come out and tell us. Do we need to be careful of how we, answer the child right away? They've just opened up to us, told us something maybe really horrible. What should we, not say back to them or to? Yeah.
Well, I think there are several things to do and other things not to do. As a first responder, you've just heard this. You didn't plan this. You had no idea it was coming. It's blindsided you. You'll probably panic a little bit, but what you can remember to do is your main role is to support the child. So you don't want to act mortified or panic-stricken, but just sort of take it in and say, I'm really sorry this has happened to you. Thank you for telling me about it. You're acknowledging them, you're acknowledging their feelings about it, and you're respecting them, saying, thank you for telling me about it. You're not in trouble. I'm really glad you told me about this. It's the right thing to do. So you're reassuring the child, providing support. If they want to talk about it, I would listen. If it's clear to you that the child has been abused, there's no question in your mind you're going to take this up to the next level. You don't need to ask a lot of questions. I would not ask more questions unless you absolutely have to. There are a couple things that you need to be able to decide on immediately as a first responder. One is, have I learned enough to let me know that I'm concerned about abuse? And the scenario you just gave me says, yes, the child opened up, told you something horrific. We don't need any more questions on that. The second question to answer in your mind is this child going to be safe in the next half an hour or hour? If they've just told you they've had the jeebers beaten out of them by their father, it's at the end of the football game, dad's waiting in the parking lot to take them home, that's a high-risk situation. But if they're telling you about being sexually assaulted at summer camp 3 months ago by somebody who's a stranger, that's different. So we need to ask, are they imminently in danger? And the third thing is, do they need immediate medical attention? Are they bleeding? Are they in pain? Those three things are really the questions you have to ask yourself as a first responder, and then provide support. What we don't want, a couple things to remember not to do is, if you can at all help it, is start blaming or shaming. What were you doing behind the gym where you got sexually assaulted? Why were you behind the gym in the first place? Or what were you wearing? Or why did you go to that party? So we don't want to say anything that the child can take as blaming or shaming. We also want to try, and this may be hard for you, it's hard for me for many years to do it, but we want to try to accept the perspective of the child. So if you have learned that a 15-year-old girl in your class has had sex with a teacher, you can see that's totally inappropriate. But the child probably doesn't see it that way and may feel like they're in love with the teacher. So it's not, as a first responder, we're not going to say, are you kidding? He's abusing you. This is exploitation. Instead, we say, tell me more about this. And, this is what I need to do. We accept their position on it because that helps to build trust and not alienate the child at this point. Somewhere down the line, somebody's going to need to talk to them about that. But as a first responder, that's not the time.
So I have a question about, kind of getting back to that idea of when you first suspect something, you become the first responder. It's about trusting your gut, right? And going with your gut instinct. So, and sometimes that's easier for educators to do because they're familiar with working with kids. They know when something's not right or not wrong, or right or wrong. And I guess what I'm trying to say or ask is, do you have any strategies or some advice for folks to maybe help them trust their gut or to make sure they're sure about taking it forward?
I think trusting your gut is a really good, it's a good rule to follow. And what I used to do for many years when I was evaluating a lot of children for possible physical abuse is I would have, say, a child in the emergency department. I was talking to them, looking at their injuries, and I would say to myself, am I going to go home tonight and worry about this child? And if the answer is yes, then I need to that's sufficient concern for me that I need to make the report. And some of it's going by gut. You just sort of step back and say, my overall impression is something isn't right here, and I'm going to worry about this. if you're going to worry about it, you have enough to go to the next level. You're not saying this child has been abused. You're not condemning the father or the mother or anyone else to prison. You're just saying, I'm worried about the safety of this child. Somebody else needs to look into this further. So that's kind of the advice I would give. It always worked well for me.
I take a breath, gather your thoughts.
What maybe a bit off or out of your day to day, but when we've kicked it up. We have a concern. We can't. I need to tell somebody. We kick it up to the higher up at maybe our individual school. At what point do we go back to them and see if anything's been done? Because I would kick it up to the the supervisor, the child protection officer, but I would still worry. What are they going to do about it? So, is there? I guess it might be hard to answer, but is there a set time when we go back for follow up? Because we've reported this, should we get follow up, or could they say, it's in our hands now, don't worry about it?
I think that'll vary with the school and with the child protection team and how they feel about it. I think it's certainly reasonable to want some follow up so that you can know how to support the child. If you find out that the child is still in the home where they're getting beaten, that's going to affect how you're going to act with the child and things that so you need to know that. Or other outcomes might be very influential in deciding how you're going to interact with the child. So that can be helpful. I think it's really important to let the child protection team know if you have additional information over the ensuing days or weeks that you think would be helpful for them. If you notice some other things, you forgot that you had noticed another bruise on this child 6 months ago, bring it up and let them know.
I think it could be in our international worlds, when so many families move every year, it's pretty hard. I still think back to kids, from 10 years ago. Man, I wonder what that family's up to now, or where are they, or how did that situation end up? And you just often never get an answer, or you can't.
Yeah.
It's tough.
I think that's one of the really hard things about this work is that we don't get the answer in so many cases.
Is there a specific approach when a kid is very, clearly traumatized, or someone is traumatized from their abuse? Is that different?
In providing support?
Yeah.
I think there are ways that you can support the child. Once the disclosure has come out, they've told somebody that they've been sexually assaulted or beaten. That's just the beginning of the trauma for them. If the police, for example, get involved and there's an investigation, there may be a medical evaluation. Lots of things are happening. If the alleged perpetrator was somebody in the family, it's going to disrupt the family completely. Right. So a lot is going on in this child's life, and they may start behaving differently as a reaction to all that stress. And so it's really important for you and others to be very supportive of the child. One of the things that we tell parents when we are seeing children for suspected sexual abuse is that I think one of the strongest predictors of recovery for the child is whether or not that child has a strong supportive adult in their life who believes them and supports them. Okay. If they don't, recovery is a lot harder. Right. So hopefully that person is going to be a parent, but it could also be teachers and coaches. And so being very supportive, sort of looking out for them, taking into consideration that there's sudden changes in behavior, they're acting out, they're failing tests, they're not doing well in the field, may be related to their trauma. Those are all things that you can do. You can also try to help brainstorm with the child what some possible triggers may be for their anxiety. Let's say a boy was sexually assaulted behind the gym, and this happened at lunchtime 2 weeks ago. The history's come out, the police are involved, child's still in school, the alleged perpetrator has been expelled. The child is going to have some periods and circumstances that are going to provoke a lot of anxiety. So you might be able to say to him, let's think about this. Are there any times during the day or places during the day where you think you might get more anxious than others? Well, probably anywhere near the gym is going to provoke a lot of anxiety, and lunchtime. So the child says, lunchtime, I hate lunchtime. So then you say, okay, let's think about where you can be at lunchtime where you can feel safe. Is there a place you can go where you can eat lunch and you can just feel safe? If in the middle of class you have an anxiety attack, what can you do? Can you talk to the teacher, maybe go to an office and feel safe? So you're trying to plan out how are you going to help them soothe themselves when they get really anxious. And I think that helping them understand their own triggers and being able to sort of calm themselves is really, really helpful. That's a big thing you can help them do.
Yeah, getting back to the idea of the road to recovery. I know every kid's different, of course, every case is different, but is there, maybe you can give us an idea of what does it look like, the road to recovery? Somebody, once they've gone, the reporting has been done, the gears are in motion to get the child help. How does that go, I guess, to move it forward?
There's no set pattern. It really varies with the child. Some children will have immediate symptoms of trauma and stress, but then recover fairly quickly. Others will take a long time and may even go on to develop post-traumatic stress disorder and depression, so that's debilitating and they really need therapy. In other cases, children may seem to do fine. We've had so many parents will say, she's fine. He's fine, no problem. I know that this happened, but she's doing well. She's in school. She's getting A's. Everything's fine. And that may be. The child may be coping and very resilient at that point. But it's also possible, and it sometimes happens, that down the road when there is some sort of an event, maybe the anniversary of the assault, or people when they move to a new environment, or the child enters puberty, some big event may trigger a lot of the trauma symptoms. So in the future, they may become depressed or develop PTSD. So it's really hard to tell. And I think it's important to tell parents that they have to be very flexible and they cannot expect their son, their daughter to recover in a month, or 6 weeks. It may be a long time. And there may be periods down the road when the symptoms come back of the stress and the anxiety.
All our listeners are in different countries all over the world. But
sure.
So this may be hard, but is there some kind of percentage, or are there some data that you can tell us about abuse in our populations, like how often it occurs or different ages?
Within the international school population, I think there's increased risk relative to some of the other populations because for numerous reasons. One is that families are so transient. It's really hard to, establish connections. And so they're sort of removed from their support, their family and their support every couple of years. They tend to be kind of in a bubble. It's also a perfect place to work if you are a sex offender, because it's very easy coming at access to kids. If somebody gets concerned and a little worried about the way you're acting, you just pick up and you leave and you go to another country, another school. Very hard to do criminal background checks on multiple countries. So it's kind of a mixture of risk factors that renders children at higher risk. When we look at sexual abuse and sexual assault, if you look across all ages and not just in international schools, but everywhere, average ages tends to be around 9 or 10 or so, but there can obviously be infants, and certainly sexual assault among adolescents is very common as well. Children who have been victims of sexual violence are at increased risk of re-traumatization as well, being re-victimized later by the same or a different person. So if the child has been sexually abused at the age of 5, they're at increased risk of sexual violence later on in their lives.
And the number's higher, it doesn't matter where in the world, but from peer-on-peer abuse to abuse from a family member, is one happen more often than the other, or?
I think it's a fairly large percentage. It certainly varies, but a fairly large percentage, it's like 30-40% in some areas of sexual abuse or assault cases that are known involve a minor as an alleged perpetrator. So peer-on-peer abuse. Again, that's only what we know. There's a whole undersurface of what is not reported.
Okay. I was wondering if you could tell us a little bit how you do a lot of outreach programming, and curious about how has the pandemic affected your work or getting the message out there for abuse awareness.
It's tough. We've tried to move a lot of our training online for educators and healthcare professionals so that they can access training from their computers, although it's difficult because so much of it is kind of an interactive thing. It makes it much harder than being in person and having role plays and scenarios to talk about. But we're reaching out that way and hoping that educators who are contacting kids on the internet and doing online teaching can become aware of possible warning signs that something may be going on in the home, and telling them how to respond to that is a big thing, because you never know what you're going to see in the background when you're talking to a child online, or if a child discloses something to an educator. What do you do? What do you say? It's much the same as you would follow in real when they're on site at school, but it's a little bit different.
Yeah, I think.
So we're reaching out in that way.
And I think when you see, maybe the older kids, at least at our schools, they're being taught and meeting with their teachers, through Zoom or another platform, and you can at least see, like you said, the backgrounds. You see what room they're in, or maybe that might be a window that you never get at school. You don't see what the home looks like.
Yeah. Exactly. Or you hear screaming in the background and realize there's a lot of chaos in the background. That's then you can talk to the child, even talk to the parents, and sort of see how the parents are coping, offer a resource, talk about positive parenting, that kind of thing. So talking to the parents, talking to the child are very helpful depending on the situation. But I think it's a whole new experience for all of us, because we don't, I don't deliver healthcare in the home. So it's suddenly you don't have any control over the child's surroundings, and either do you as educators, and it's very different.
Wow. And some of the resources, I know there's a section on the ICMEC website that's specifically, a COVID-19 section. Are there some tips for people in there, if they?
Yeah, there are a series of short, 5-minute videos talking about COVID-19 and the sort of educator response, school response to that. And I think those are pretty helpful. They talk a lot about what we've been talking about during this podcast, but other aspects of sort of monitoring online as well, and what you do if you suspect something is going on, and providing resources. There's one thing that I'm wondering if I could just say that I think comes up a lot, and I think it's important to talk about. Is it all right if I give it?
Absolutely. Yeah, we love to hear it from you.
I think that in some cases, teachers and coaches have been confronted with children who want to disclose something to them, but they want to keep it a secret. So the question is, what do you do? So I think it's not unusual for, let's pick a 13-year-old boy, comes up to you and says, I need to tell you something. I need to talk to you about something, but you can't tell it's a secret. I don't know if you've ever had that happen to you, but probably at some point. And so the question is, what do you do? And I think it's very helpful to have a game plan in place for that. And what you might want to do is something along the lines of this, not necessarily exactly this, but just something along the lines of, say, I can tell you want to tell me something. I'd really like to hear it because I'd like to help you if I can. But before we get into it, I need you to know that if you tell me anything that makes me concerned about your safety, if someone's hurting you or will hurt you, or you'll hurt yourself or someone else, I will need to go talk to Mr. Joseph, the child protection officer, so that he can help me help you. I just need you to know that. And other people may need to become involved if your safety is at stake. So just know that before we start. Now the child says, are you kidding? I'm not going to tell you then. You're not going to keep a secret? Forget it. Unless you can keep a secret, I'm not going to tell you. You're panicking now, and it's so easy to say, okay, all right, I'll keep the secret. We don't want to do that. We want to say, you might put it back on the child and say, you seem really concerned about what might happen if anybody else knows. What is your concern? Tell me about why you're concerned about that. You're not asking what the secret is. You're saying, why is it a secret? So you're coming back around that way and getting them to open up a little bit. Now they may, you can talk to them about possible reassurance that that they can get help that way. Ultimately, though, we can't force the child. So if they say, well, forget it then, I'm not going to tell you. Then what you can say is, well, my door is open. I'm always here. I'd like to help you, and I'm here for you if you change your mind, or is there somebody else that you can talk to? And then I would, because the child has sort of gone this far, has not disclosed anything, to me that's been a very significant thing. I would take that and report to the child protection officer. I don't have a specific allegation, but this child has something that's really bothering him.
Right. Oh, that's great. I did have someone say that to me, but thankfully it was just about a girl they had a crush on, so it wasn't it wasn't any concern.
That's great.
But I did think, well, what's going to come?
You dodged that bullet.
Yeah, absolutely, absolutely. You do never know, right? It's
you don't. Yeah. You don't never know.
Well, I just want to say thank you very much for these insights today. And a personal note, I want to say thank you for all the hard work you do. And you're on the front lines of this this issue in the world. And I just want to say thank you all you do for kids and making the world a safer place. So
thank you for what you do.
And, get more awareness about the topic, and unfortunately, it's something that does exist. We hope that it will come to an end at some point. But I think the more we talk about it, the more we let our guard down about it, to know that to understand that it is a real topic, and it does happen in schools, no matter all over the world, international, private, public. It's something that we need to know about. So thanks for the insights today.
Yeah, thank you.
Thanks for having me. I appreciate it.
Yeah. Well, it just didn't seem right to interrupt our conversation today with ad breaks. But before you go, please take a second and listen to a little bit about two companies that we really enjoy working with and use often. And thanks.
Coach Evaluator is the premier coach evaluation software for schools and athletic organizations, and the preferred coach evaluation solution of the NIAAA and the Positive Coaching Alliance. The system is completely customizable with an always growing evaluation template library for athletic directors to reference. There are not only evaluations for ADs to use, but also self-evaluations and parent-player evaluations of coaches. Learn more about digitizing and simplifying your coach evaluation process by visiting www.coachevaluator.com.
If your school is in the market for bespoke sportswear, look no further than Kukri Sports. Kukri has evolved over the last 20 years from a bespoke sportswear manufacturer into a true sportswear partner, firmly believing in the value of sport at all levels. Kukri Sports creates a sportswear range that inspires as well as performs. Start your journey today. Email the team at contact@kukrisports.com.
Until next week, this has been another episode of the Globetrottin ADs.